Hello and welcome back to my channel. If this is your first time here, I'm Nurse Alyssa, and today we're going to be discussing anal fistulas. But first, if you could smash that subscribe button, it would be greatly appreciated as it truly does help my channel grow. So let's get started. So an anal fistula is a tunnel that connects the inside of the anus to the outside of the anus. So there is a tunnel connecting the two from the inside to the outside. Normally, people will notice when it starts to become infected. It normally starts at an anal gland, and either it'll start puffing up, be infected, and either it'll just start draining on its own or it needs to be surgically drained. Now, the tunnel normally does stay open even after it's drained. So a lot of times it will need surgery to actually close the fistula. So some symptoms of anal fistulas is that there's an opening. Normally the doctor can see it. It'll be red, inflamed around the opening. It can be oozing pus, blood, or fecal matter because it's going from the inside of the intestines to the outside. It can leak stool. Pain in the rectum and anus area, especially when sitting or passing stool. Okay, so there will be a lot of pain in that area, especially if it's inflamed, infected. So most anal fistulas are caused by an infection that starts in the anal gland. Now, infections resulting in an abscess that drains on its own or has to be drained surgically through the skin next to the anus. Now, a fistula is a tunnel that forms under the skin along the drainage tract. Okay, the tunnels connect the anal gland or anal canal to a hole on the outside of the skin around the anus. So rings of sphincter muscles, okay, at the opening of the anus that allow you to control your stool. This is what classifies the actual fistula, okay? So the classification helps the surgeon determine the treatment options. Okay, so depending on where it is in the sphincter muscles is how they'll determine the treatment. So risk factors. If you've previously had an abscess that was drained, you're at higher risk of having another one. Crohn's disease or other inflammatory bowel diseases, you're at higher risk. Trauma to the anal area, infections of the anal area, such as surgery, radiation, anal cancer will increase your risk of an abscess in that area. Now, anal fistulas occur more in adults around the age of 40, but may occur in younger people, okay, especially if there's a history of Crohn's disease. And anal fistulas happen more in men than females. So complications. So even with an effective treatment of an anal fistula, reoccurrence of an abscess is definitely possible. Okay, once you have one, it's very possible to have another. Now, surgical treatment might result in the inability to hold stool, so having stool incontinence after surgery. So that is another complication that can happen. So how do they diagnose an anal fistula? So most of the time it's through a physical examination. Now the outside opening is usually the easiest to find. Now the internal opening can be sometimes a little more difficult. So sometimes they do have to do some more tests to actually find the opening on the inside, because we have to know where the opening is to effectively treat the fistula. Okay, so sometimes like an MRI or they'll inject a dye. It just depends. There's a bunch of different tests that they can do that I've included on here to find out where the opening is. Okay, so treatment of an anal fistula really depends on the location and complexity that it's caused, okay? So the goal is to repair the anal fistula completely to prevent reoccurrence, and we also want to protect the sphincter muscles really to prevent any incontinence, okay? So we really want to protect those muscles as much as we can so they do have control over their bowels. And then, although surgery is usually required, there are some non-surgical treatment options that your doctor may discuss with you. But I have included here some surgical options that they can do. Completely depends on the complexity of the fistula, though. So some lifestyle and home remedies that you can do at home. For the most part, pain medication, soaking in a sitz bath, adding fiber to your diet to make sure that you're preventing constipation, and avoiding straining during bowel movements. So you're really increasing your fiber intake and increasing your water will help with the bowel movements, and adding in some physical activity is always good for that also. So what you want to do before your doctor's visit, and now most of the time you'll see your family doctor and then they'll refer you to a specialist. At least I know that's what they do here. So you're going to want to make sure that you have a list of your symptoms, personal information, stressors, life change, medical history. If you've had this previously, and the dates, and all your medications, vitamins, supplements, herbals that you're on, you're going to want to write all those down, the frequency and doses with that. And then, so they will do a complete examination when you go to the specialist. So just make sure that you are prepared. I've added in a few questions here that they normally do ask. So just when your symptoms began, is it constant or occasional? How severe are your symptoms? Where do you feel your symptoms the most? Does anything seem to improve your symptoms? Does anything make it worse? Do you have any other medical conditions such as Crohn's disease? And whether or not you have problems with constipation. So those are just some questions that I thought I should add in here, just so you're prepared and kind of have an answer for their questions. So that's all that I have for this video. I hope it did help you better understand what an anal fistula is, and I hope to see you guys in my next video. See you guys.